In today's video, with the help of the cadavers here in the lab, we're going to be taking a look at the various tissues and structures that are affected by first, second, third, and yes, even fourth degree burns. It's going to be an intense one. Let's do this. You are looking at a lower leg that has been cut in the mid-thigh, so you can see that transverse cross-section. And this is what we call a step dissection. And the reason we call it that is because you can literally see us going deeper down into the body. Now, a lot of people are going to wonder why on earth there is a sock on the foot. And that's because the foot hasn't been dissected and the feet can dry out rather easily. So what we do is we soak the sock in phenoxyethanol, which is our wetting agent, and that helps keep it hydrated. Now, in terms of classifying burns, it really depends on who you're talking to and how they'll classify it. Some will just call it a superficial burn or a partial thickness or full thickness burn. Others will say it's a first degree, second degree, third degree. Some say it goes all the way up to 6 degrees for a burn. However, I always taught it as being 4 degrees, so that's what I'm going to teach you now, but it really doesn't matter. As long as you understand what's being burned and what that means in terms of treatment and recovery, that's all that really matters. So what we're going to talk about first, to no one's surprise, is going to be a first degree burn. Now, a first degree burn is only going to affect the superficial-most layer of your integumentary system called the epidermis. And that's what you see here. It's this paper-thin layer resting on top of the dermis. Now, the epidermis is there to protect you from friction and abrasion, so it's going to be avascular. What that means is there's no blood supply actually traveling through the epidermis. Instead, it's going to get its blood supply from the dermis, and that's actually going to play an important role because when you get a burn, it's actually going to be red. That redness is coming from the blood vessels in the dermis that are going to be sending blood to that burned area to help replace and replenish the damaged tissue. But you're also going to get dry and flaky skin, and that is due to the fact that, well, the cells are dead, so they're flaking off. So what's going to happen is they dry up and then they flake off just as they normally would, except now it's in mass because you destroyed a ton of the area. Now, first degree burns are typically not all that troublesome because the epidermis is meant to replace itself. So you just accelerated the process, but it's going to eventually catch up and you will be like new again. In fact, first degree burns don't come with scars, so most people really don't see them as much of a big deal. Now, second degree burns are a completely different story, and that's because inside of the dermis, which is this layer here, the second layer down, you're going to find a lot of interesting stuff, such as blood vessels, nerve endings, sweat glands, hair follicles, tiny little muscles that move the hair follicles. It's a very busy area, and now the burn is starting to damage and destroy the structures inside of there. This is going to come with scarring. This is going to come with blistering and fluid just leaking. And since you've irritated and damaged the nerve endings, it's going to be extremely painful. But what you'll also typically see on the outside of a second degree burn are first degree burns. So, because you still had damaged tissue on that epidermis and you'll have this ring of a first degree burn as you're making it into the second degree burn, which is then burrowing its way down into the deeper layers. But the third degree is where things get really, really messy. We're now looking at a zoomed in angle of our step dissection. So this direction here would be going towards the knee and then this direction would be going towards the ankle. But I want to focus on this step. This narrow yellow band is the hypodermis or the subcutaneous tissue. Now this is going to be filled with adipose cells. So obviously, depending on the individual, this is going to vary in thickness, but it's going to be just underneath. Let's see if I can pull this up. I don't know how well you're going to be able to see that, the epidermis and the dermis, obviously. So if the burn has made its way down here, this is called a third degree burn. And this is a very severe type of burn because you've burned through, again, the epidermis and the dermis and everything inside of the dermis. Sweat glands, blood vessels, hair follicles, and nerve endings, which is actually pretty important because if you burn through the nerve ending, then there's nothing there to send the painful signal to your brain, meaning that third degree burns typically don't feel as painful as a second degree burn. But that doesn't make it any better because think about this. If you have, say, a burn this big, you've burned through all this tissue, you now have this crusty, burned, necrotic area, and that can crust over and become what's called an eschar. An eschar, again, just you can think of it like a scab, but it's not a scab because a scab is part of the normal healing process. This is just a mass, a clump of dead tissue, and it can become infected, which is exactly why it's recommended no matter how small of a third-degree burn you may have, you need to seek medical attention because, I mean, come on, the skin is missing it. The epidermis and dermis, part of their function is to protect the deeper tissues from stuff just getting inside of it, and now it's gone, and you have this hardened clump of dead cells. That's not good. You need to get that taken care of. Now, depending on how big the third degree burn is, I mean, you can think about this. Like, we've been talking about this small burn. Let's say it's gonna be like this massive area. You may require a skin graft. With a skin graft, it can be partial thickness or full thickness, and that really just comes down to, you know, how much of the dermis are they taking? Are they taking part of the dermis or are they taking the full thickness of the dermis? And they'll typically take this from a different area of your body, and then they will place it over the area so that you don't, because I mean, think about it, you don't have the tissue to heal, right? If there's no dermis, there's no epidermis, it's hard for the body to just replace that. The only thing it can do is have massive amounts of scarring, and that is gonna come with a whole set of other issues. So they tend to give skin grafts if they can in order to try and bring things back to as normal of a situation as possible. But if that wasn't bad enough, it gets worse. Now we're going to the fourth degree. So if we go back to our zoomed in angle on the step dissection here, again, there's that hypodermis. Well, underneath the hypodermis, we have this next step. This is called fascia. Fascia is a bunch of collagen proteins that wrap and compartmentalize muscles, skeletal muscles, and that's exactly what you see here. If the burn has gone through the hypodermis and now made it to fascia, it's now a fourth degree, but it doesn't just stop there. A fourth degree also includes going deeper underneath it and burning skeletal muscle tissue. It includes, let me rotate this around, burning the surface of bones, another tissue called periosteum. This is essentially made of the same stuff as fascia. It just wraps the outside of bone, and then underneath the periosteum, we have compact bone. And you may be wondering what this little window is. This is a window we've cut into the tibia to show you the hollow center of the bone. But if the burn is going through this, it could even go through tendons, which you can see here. It can burn ligaments, all of that. Anything deeper than that hypodermis is classified as a fourth degree burn. And this is a horrific type of injury because, I mean, as you can tell, skin grafts are probably not even going to be very feasible for most instances, meaning amputation is very, very likely. Infection is very, very likely. To say this is life-threatening would be putting it lightly. Burns are absolutely, without question, no joke. Now, real quickly, I do want to talk about the different causes of burns. Now, I've always taught there being 4 primary causes of burns, but again, depending on who you talk to, they may come up and further subdivide it and create different causes. The first is going to be a thermal type of burn. Now, that just means temperature-based, and that's not always heat. You can also get burned from something very cold. In fact, we call it an ice burn. Just picture this. You get a piece of ice, you stick it on your skin, and you leave it there. You do that for long enough, you can cause enough damage to create an ice burn. Now, it's essentially just frostbite, but since you're physically applying the cold object to the skin, that's what creates or makes it a burn. Now, for heat, typically scalding water is going to be the most common form of a heat burn. But anything above 155 degrees or 68 degrees Celsius is going to cause a burn essentially instantaneously. So any higher temperature beyond that, you're just going to more easily torch through those layers. Now, you also have chemical burns. Chemical burns, those happen from a variety of different things, such as a lot of it's household cleaners, maybe like it's ammonia, but it can also be even hair dye products. Maybe you're leaving it on there. I know estheticians will even purposely do acid peels to peel off layers. That's an intentional, purposeful chemical burn that you're actually applying onto the skin. There's also electrical burns. With an electrical burn though, these ones can be very deceptive. So if we go back to the cadaver here, let's say you get an electric shock, a significant shock right here. It may appear as a second degree burn here, but the electricity would have gone deeper down into the tissues. So you can actually have a second degree burn throughout all of it, which can be pretty severe, especially if you get shocked in the face or if you get shocked in the torso. You can have the electricity going through organs, and it can definitely affect the heart, which is why if you get an electrical shock or electrical burn, you definitely want to get that checked out. And then the last type is a radiation burn. The most common form of that is a sunburn, right, from ultraviolet light from the sun coming through the atmosphere. But this can also happen due to radiation therapies. Say like if you're getting cancer treatment, the radiation can literally burn your skin, but this could happen from an X-ray if you were overly exposed to that, or a gamma ray. Let's say maybe you are on your way to becoming the Hulk. Thanks for watching, everybody. I really hope you enjoyed today's video, but as always, be sure to like, comment, subscribe if you feel so inclined, and I will see you in the next video.